we're using oral drugs more and more. The drugs palbociclib and everolimus, that is Ibrance and Afinitor, can cause a lot of side effects that make patients discontinue earlier than they might need to if we could manage symptoms. So it's very important to not only anticipate the symptoms, to educate the patient about the symptoms, but to monitor them as patients go along. For everolimus, mouth sores early on is something that is seen in about 20–30% of patients. They're usually mild, but it is an important reason for people stopping therapy. And it can come on very quickly and be very intense, especially at the beginning of therapy, but it's not a problem later on. So if patients can get through that first phase, they may actually stay on therapy. That first phase can be made much easier by not only monitoring, but actually there's some interventions now that help. There was a study that showed that using steroid mouthwash, just a 1% steroid dexamethasone solution, seemed to really lower the number of people that have mouth sores and that have to come off. So this is something that can be passed on to patients ahead of time, certainly early monitoring, and if they do get mouth sores, again, there are those treatments and others that can help. And the same thing with Ibrance, not so much in the way of mouth ulcers, but fatigue, monitoring a low white count, the rare risk of infection, all of these things need to be monitored. So I think that this is a general area that is really evolving. We call these new drugs oncolytics, oral oncolytics. These are oral drugs that are actually cancer drugs and have side effects.